And I said, come over, come over, come on over, you'll say.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. This is episode number 44, and this earmarks the first episode with our new commander-in-chief at the helm, Mr. Ryan Curley. So Ryan's in the studio with us. Hi, Ryan. How are you?
I'm good. How you doing, Dave?
Oh, good, man. We did. We had our Chamber of Commerce meeting yesterday, and both you and Mr. Russ Melmed's on the line also, our Director of Health for the Chatham Health District, and we got a lot to talk about. So anyway, go from there. So tell us, Ryan, how has the first few weeks been here? And you got thrown in the deep end of the pool.
Yeah, so to speak. It's been busy, but so far very rewarding. It's been a lot of learning,
Sure.
on new things, but also continuing some old things. So trying to keep all the balls in the air that
Absolutely.
were already in the air from before, and also keep going with the agenda that I ran on and was elected to do as well. So there's plenty to get done, that's for sure.
Sure. Well, we had our first full selectmen's meeting last night. That went pretty well and moved it along. So which is a good thing. So anyway, so tell us a little bit about where we are and where you're going, and we'll go from there. And then we can throw it over to Russ, and he can give us the Omicron. Is that how we pronounce it, Russ?
Well, I don't speak Greek, Dave, but that's just how I understand it. It's pronounced Omicron.
Okay.
I've heard Omicron, but I believe it's Omicron.
Omicron. Okay. Well, we'll get to you on the Omicron and we'll go from there. So anyway, tell us, Ryan, where we are and how are we going to get there?
Sure. Well, I'll say that the town is in pretty good shape to begin with. We've had a lot of recent economic development activity that has been going on in town, and as First Selectman, and I know the board, we want to continue that. We want to keep that going and bring in more business and highlight the businesses that we have, because we do have a lot of good things going on in town. And so one of the things that I'm most excited about is this brownfields redevelopment project that has been in the works. And I believe the last time, and in the last podcast, I don't believe we had received that topper grant that we had on.
No, I think you're right.
So that is a big compliment to the town, and special thanks to our previous First Selectwoman Susan Bransfield for getting that for the town, and that's an additional $375,000 grant to go on top of the $750,000 grant that we had received from DECD to clean up this brownfields development site that is along the Connecticut River. It's on Brownstone Avenue.
Right.
And it's 3 parcels of land, and this really has the potential to be an economic driver for the town. But first we have to clean this property.
Get it up. Yep.
Exactly. So that's what this grant money, this grant fund allows us to do. And so last night at the Board of Selectmen meeting, the board approved the low bidder, essentially, which is Enviro Consultants and Recyclers, and they're the ones that are going to be doing the remediation effort, and we're working with Ty and Bond, and we're excited to move that along. We actually have a special meeting. It's a joint meeting of the Board of Selectmen and the Brownfields Redevelopment Commission, and that's going to be next Wednesday at 7 p.m., and Amy Valancourt from Ty and Bond will be coming to give us a presentation of where we are now and where we're going with this project and the next steps. So I think it's important to keep all the stakeholders up to date on this and to realize that this is a very good thing for the town.
Sure.
And so what happens after the property is fixed,
Cleaned up, yeah.
Cleaned up. We'll have to go from there. But but one step at a time, and we're very excited for this project. So
Sure, absolutely. Well, that extra money certainly opens up a few more options as far as that goes.
exactly.
You know, and go from there. That's excellent. That's good news. Go from there.
And so I just want to say, just for some events that are coming up.
Sure.
We have the Festival of Wreaths is this weekend, and that is at, I believe it's 325 Main Street, and it is both on Saturday and Sunday. And we also have the tree lighting event, which I know you'll be emceeing, right? On
I usually do. I think this is probably year 30 something. I don't know, but I've been there for a long time.
Dave is an institution at these events. We wouldn't have it any other way. And that'll be on December 5th, Sunday.
Sunday, yeah.
From 4 to 6.
Yep.
I believe Santa will be making an appearance.
That's the rumor.
That's the rumor.
That is the rumor. So the big man in red is going to be there, and he'll be there in all his glory. And I understand that because we have lack of snow right now, I think the fire department is taking the lead in getting him there. So.
Awesome. Well, I'm excited to see that and to see everyone in town down there too. I hope it's well attended because we didn't have it last year.
I know. And well, we'll have the high school a cappella choir. Okay, Mr. Sam Tucker and his group is going to be there, as well as Kristen Novak's Portland High School band are going to be there. So we can get those festive hats out and come down and sing along with the choir and get in that holiday spirit.
Absolutely. I also want to give a shout out to our local Quarry View, who has their filming, I believe, beginning today
Yes.
for their Netflix movie. It's a Stephen King feature, and it's going to be filmed here in town, or at least parts of it.
Yep.
And so that's Dean Soucy and Darlene Rice. Yeah,
Yep.
we're very proud of all the work that they've done at Quarry View. And for those who haven't seen it yet, they do tours if you
Sure.
would like to reach out to them. And I've been down there several times, and every time it's just incredible to see. So we're very proud of them as well.
Sure. Yeah. I know they host some events down there. They have drum circles that are down there, which are awesome. So if you want to get engaged and see a lot of the history of the town, go down there. And like you say, Dean and Darlene have done a great job in cleaning the place up and really making it a destination for the town.
Yeah, absolutely.
So, okay, obviously we have a lot more activity going on at Brainerd Place.
We do. Yes, we do. So right now, the demoing of some buildings is underway. So progress is being done. I actually just spoke with Mary Dickerson earlier this morning. And so the way, it's my understanding, the way things work now are they have to go building by building to make sure that they test everything that needs to be tested, and
All of the utilities are disconnected.
Exactly. So it's slow and steady, I would say, but at the same time, progress is being made, and so this is something that's been in the works for
A long time.
very long time. So we're very excited to see progress being made, and it's all of our hopes that this progress continues, and that this project will move along at the speed that we've discussed, and
Sure.
and it's going to be a great thing for the town.
I think it'll increase that tax base, and again, it's something long in coming. So that's going to be a welcome and revitalize that downtown area in the Village District, and again, expand our tax rolls and get some housing and some apartments in there. So for professionals, I think it's going to be a welcome thing. Plus, we're going to have a Starbucks, man. That's,
Starbucks would be good. Starbucks would be good. And so I guess while we're on it, I just want to highlight a couple other things for economic development. I'd like to just say that I'd like to encourage residents in town, when you're considering doing your Christmas shopping, this year. It's always great to shop local. We have
Yes.
some great businesses in town, and so gift cards go a long way. And we also have some new businesses coming. We have Dr. Pete at 255 Main Street. That's an over $1 million project that's
Yeah.
underway,
Yeah.
and it's looking beautiful down there too.
Yeah. That's the old TD Bank building.
Yep.
Yeah, and so forth.
So we're going to get 8,000 visitors a year at that site. So that's a lot of teeth cleanings, Dave.
Yeah,
So-
exactly. A lot of cavities, too.
But that's great for the town. And then also we have a new farm in town, Star Hill Farm. I don't know if you've been out.
I have not.
But it's. I would advise you to take a drive after the sun goes down because boy, they have it all lit up out on Glastonbury Turnpike. And
Yes.
it looks beautiful out there, and I hear the rumor is Santa is out there as well on the
Nice.
weekends. So,
All right.
So yeah, another great business to have in town. So we're happy to have them.
Absolutely, absolutely. So fantastic, and there's just a lot happening. I know, as you know, that we've got some water issues that we've got to take care of, and so hopefully we can start moving that initiative forward and see if we can become a little bit more self-sustaining. As far as that
Absolutely.
goes.
We're waiting. I've already spoken with our finance director, Tom Robinson, about this, and we're waiting on this RFP to come back. I think it's December 3rd, so it's coming up.
Yeah, well,
And-
it's burning daylight because we've got again the MDC contract is going to be coming to an end in 2026, so we've got to be in a position that we've got to have a place to go.
We got to be ready. This is a top priority for us.
Absolutely,
Yeah,
absolutely.
absolutely.
So anyway, all right. Anything else? We'll.
I think that's it for me. Well, I think Russ has plenty to say with everything going on. So
Yeah, he's got a whole 3-ring binder full of stuff to go. So anyway, how's everything out in the great state of East Hampton there, Russ?
Looking out my window, it's a nice-looking day.
It
It's
is.
not, I guess, unseasonably warm today for an early December morning. So things are nice.
We'll
here.
take it. We'll take it.
Yeah, I'll take it.
So anyway, tell us what's happening on the COVID and Omicron front.
Sure, gosh. Well, lots to say there. Let me just give a Portland-specific update. We're seeing cases rise all around the state. Portland is no exception. Right now we're seeing a case rate of about 19 per 100,000 in town of Portland, which is a lot of COVID-19. And, we only know about 1 out of every 4 cases. That's sort of the estimate. We identify about 1 out of every 4 cases. And that ratio is actually getting worse because of the advent or the introduction of at-home tests, which are great. I don't want to tell people not to do at-home tests, but typically those don't get reported through any official channels to us. So the cases we know about, there's probably around 3 or 4 times as many out there. So there's a lot of COVID-19 out there. The good news is we're approaching in Portland anyway. We're already over 70% of the population have been fully vaccinated in town, and we're approaching 80% having initiated vaccination. So that's a pretty significant jump. And we're getting close to that magic 80% number that we want to see to really be able to suppress transmission of the virus. I think a large share of the increase we've seen lately is among young children. There was a pretty big surge in demand once vaccines became available to children as young as 5, and we continue to see heavy interest. So on the vaccination front, Portland is doing very well. Whenever there's a lot of COVID out there, it doesn't necessarily mean people are, dying left and right in the street. That's really not happening because vaccines work really well to prevent severe disease. So we haven't had a new fatality in town of Portland from COVID-19 in quite a long time. Mm-hmm. We are seeing hospitalizations tick up a little bit in the state. That's to be expected when you have a lot of COVID-19. Even if hospitalization is a fairly rare event, when you have a lot of people getting COVID, those rare events will start to add up. So, be safe out there. If you're getting together for the holidays, good idea to get tested before you get together, especially if you're getting together with, older adults or people who have specific vulnerable underlying health conditions, or especially people who are immunocompromised or people in those categories who haven't been vaccinated. So a good idea to get a test. At-home tests are a nice way to do that, pretty convenient. And there are also other, either appointment or no appointment necessary, drive-up testing sites around the state. So
Right.
just a word to encourage folks before they get together for the holidays.
Right. Now, the infections that you're seeing now, or the new cases, are they primarily unvaccinated, or are they breakthrough?
Yes. So the breakdown is like this. About 30% of all the cases we're seeing are among people who are vaccinated, and about 70% among the unvaccinated. So, but when you consider that, about 2/3 of the population is fully vaccinated, that breaks down to about, 5 times. You're about 5 times as likely to become infected if you're unvaccinated compared to if you're vaccinated.
Mm-hmm.
So, the vaccines continue to work to prevent some infections, not all. We do have these breakthrough cases. But in terms of hospitalization, we're still seeing that ratio at around 8 times. So if you're vaccinated, you're about 8 times less likely to end up in the hospital if you get COVID-19 compared to people who are unvaccinated. And that really rare event, fatalities, that ratio is about 12 times. So if you're unvaccinated, you're about 12 times as likely to die from COVID-19 as if you are vaccinated. So,
Okay.
Vaccines are really, really effective at preventing severe disease, but unfortunately, we are still seeing that some people are getting infected, which is why getting tested, even if you're fully vaccinated, before getting together with anybody who might be really susceptible to a severe case of COVID-19 is just a good idea.
Sure.
And, if you do test positive, stay home. Stay home for 10 days.
Absolutely.
And try to isolate yourself from others in your household and elsewhere from work and school and things like that. So that's sort of generally what's going on with COVID-19 locally and in the state. Of course, nationally, what's been in the news a lot is Omicron. There seems to be quite a bit of concern about this new variant that's emerged in South Africa and has now been identified in several dozen other countries, including in the United States now. The concern is really based on what evolutionary virologists have identified in the genome. There are 2 areas of the genome that they focus on. One area is the area that codes for the spike protein on the surface of the virus. That's the protein that the virus uses to bind to our cells. And when there are changes in the spike protein, it can go one of 2 ways. It can either make it much more easily for the virus to bind to our cells when we're invaded by the virus, and it can also help the virus evade natural or vaccine-induced immunity. So those are the 2 concerns when those virologists see changes in the genome. What they don't know yet is actually what those changes mean in terms of how the virus behaves. You can't tell right now by looking at the genetic changes and say, well, this change means it's going to be more transmissible, and this change means it's going to evade the immune system. They actually don't know until they start studying it and how it circulates in actual people. There really, unfortunately, is no substitute for seeing how the virus behaves once it starts infecting a population. So what that means is we have to wait a few weeks before enough people have been sick and identified to have this variant to know exactly how it's going to behave. So I'm an optimist. I think I mentioned this at the Chamber of Commerce meeting earlier this week that you and Ryan were at. There's a chance, crossing my fingers, that this could be the virus that helps us, the variant that actually helps us. And here's how that could happen. If it is more transmissible but less severe, that's better for us than Delta. In fact, what would happen is if it's more transmissible than the Delta variant, which is currently dominant here, it will eventually push that variant out of the way and dominate everybody in this area. So what you will be exposed to and infected with will be this new Omicron variant, not Delta. And if it's less severe than Delta, well, then that's a good thing. That's the variant that we quote unquote want. We don't want one that is more transmissible and more severe. And we also don't want one that actually evades our vaccine or our natural immunity. So that's the big question also, is once it starts circulating, will our vaccines work? How effective will they continue to be? Will people who had COVID-19 and recovered, will they still be immune? So those are the things that we just don't know. I'm not sounding alarms yet. I think it's wise what the federal government is doing, which is trying to restrict travel from those areas where the virus is circulating quite a bit. We don't want to, even though it's already in this country, we don't want to introduce it into more ports of entry.
Right.
If it's in California, let's keep it there and let it slow it down there. If it's in New York, let's keep it there. Let's not invite people to fly into Boston. So I think it's wise to see how the variant behaves, and in the meantime, try to step up our mitigation strategies like some travel restrictions. Testing is a really important way that we can prevent transmission. Right now, what the federal government is saying is get a booster because they believe that the vaccines will continue to be effective. The degree to which they'll be effective is a little bit unknown at this point, but boosters will boost your immune response. And so if they remain somewhat effective against this new variant, then when you're exposed and you've had a booster, you're less likely to get infected, you're less likely to have severe disease, even if it does sidestep some of the immune response.
Right.
So that's Omicron in a nutshell. You know, when it's time to be alarmed, I'll come on this podcast and I'll say,
Ring the bell.
This doesn't look good.
Yeah. Well, I think the first confirmed cases, I think, in San Francisco.
Yes, that's right.
And so
Correct.
forth. So I'm not aware of anything on the East Coast. That are you aware of anything?
No, but what I'll say is the only way we become aware is when somebody gets sick, gets tested, is positive, and then that sample randomly winds up in one of the labs that is actually doing sequencing. And unfortunately, we don't do a lot of that, Dave, in this country. I mean, we really should be doing more. I think right now we are sequencing somewhere in the area of 2 to 3% of all positive samples. That's not a lot of sequencing. In fact, I think we're somewhere around 25th in the world in the proportion of samples that we sequence.
Right. Can you just define what sequencing is for our listeners?
Sure. It's when you take when you isolate the virus from an actual sample from a sick person, and you describe or you identify its genetic code. So when you look at the genetic code of a virus, that's where you can tell what variant it is, because the different variants will have different DNA or different RNA sequences. So sequencing means you take that RNA and you actually identify the nucleic acid base pairs, and you say this is what the gene code looks like. So that's what sequencing means. It's a fairly involved process. It used to be very, very expensive. It's less so now, but we're just not doing a whole lot of it. So my expectation, honestly, is it's here on the East Coast, and we just haven't detected it yet. It's just a matter of time.
Now, as far as contact tracing, do you have to alter your inquiries on the contact tracing to accommodate this variant? Or
no, our contact tracing has always involved questions about recent travel, for example. So, just to refresh our podcast listeners about what contact tracing is, anytime somebody tests positive for COVID-19, that gets reported to the health department. We get a name and a phone number, and we call that individual, and we ask them questions like, have you been to any large gatherings recently? Have you traveled anywhere recently? Where have you traveled? So we try to identify potential sources of their infection. And if, for example, somebody said, well, I just came back from Cape Town, then that sample might get flagged for sequencing. We don't do that flagging. That just goes into a database, and once it gets there, I'm not sure how it's handled. But we do ask those questions, and so things might get flagged as sort of a high risk for Omicron or other variants as they emerge.
Right.
So no, I mean, contact tracing hasn't really changed. I don't expect it to change much. But as we learn more about Omicron, it could change.
Sure. Now your staff is pretty much doing all of the contact tracing now? Or?
Oh, gosh. At this point, we have so many cases of COVID-19 that we can't possibly do it all.
Okay.
So we have 2 full-time staff members that do contact tracing here, among other things. We have 3 volunteer Medical Reserve Corps volunteers that do contact tracing for us. I do some contact tracing for us. But the sheer volume of cases we have right now is just too much. So right now we're doing the best we can. When it gets to this point, we try to prioritize the people who we think it's most important to reach. So parents of school-age children or school-age children themselves, older adults. Typically that's a lower risk for transmission. So we would focus on working-age adults. So the people who are more likely to get out there and spread the virus around, those are the folks that we try to reach most critically. We sort of triage.
Right.
The State Department of Public Health does have some contact tracing surge capacity. They do try to reach the ones that we can't, but at this point, it's one phone call only. If they don't answer, that's it.
Okay.
So we try. So my message to everybody who's listening is, if you test positive for COVID-19 and you see a phone number come up on caller ID in the few days after you get that positive test result and you don't recognize it, it could be a local contact tracer or a state contact tracer. Please answer the phone. It's really important, and it really helps to suppress transmission of COVID-19. All we do is ask questions about, what the source of the infection was, who you spent time with after you were infected, and ask if you need help reaching out to those people to let them know they might have been exposed.
Right.
And as we move forward in this, winter surge, contact tracing will become more strained. So if you don't get that call, my recommendation to listeners is, as soon as you find out you have COVID-19, call the people that you were around in up to 48 hours before you started getting sick. That's how long. That's when you start transmitting the virus. And just let them know, I tested positive for COVID-19. You should probably get tested and quarantine until then.
Right.
So, everybody can play their own part here.
Sure. No, absolutely. Now, in the update you gave yesterday at the chamber and so forth, now you're also fairly involved now in the restaurant inspections and so forth.
Yeah. So before COVID-19, a lot of what people knew the health department did was inspect restaurants, and we continue to do that. It's a statutory requirement. We inspect restaurants. We license restaurants. So over the last year, we were fortunate in two ways. One, we got funding specifically through grants and from our municipalities through the Municipal Coronavirus Relief Fund to run vaccine clinics. What we weren't anticipating was the ability to bill for administration of that through health insurance providers and through HRSA, which is a federal program that reimburses healthcare providers for certain activities related to the pandemic. So we were able to bill for our COVID-19 administration. So that generated some unexpected revenues. Also, we were anticipating that revenues from other things like permits and things like that would be down this year. They weren't because of the stimulus funds that were injected into the economy. So we actually, from a revenue perspective, and the health department did well. And so instead of what governments often do, which is take that extra revenue and put it into undesignated fund balances, we're at least taking some of that and giving it back to our food service establishments. And this is what we're doing. We're asking all our licensed food service establishments to voluntarily adopt, if they're interested, a COVID-19 prevention policy or practice. We're letting them choose. They can tell us what they're planning to do, whether it's putting up a sign telling people to wear a mask until they're seated and eating, if it's in a restaurant, or hosting a vaccine clinic, or sharing our prevention messages from our social media on their social media page. Whatever they choose to do, they just have to tell us what they're doing, and they'll be entered into a drawing to have their annual 2022 license fee waived.
Right.
I'd say a modicum of regulatory financial relief for these businesses, but they've really taken a hit. We want to continue partnering with them. They're so important as trusted messengers in the community that they can continue to play a role in preventing COVID-19 transmission. And so if our interests and their interests can align, and they can get a little financial relief by doing something pretty simple, I'm supportive of that, and the board was as well. So our board allocated around $7,000 for that purpose.
Oh,
so,
nice. Okay.
Somewhere in the area of 10 to 12% of all our establishments will be winners if they all enter into the drawing. So that's it's a pretty good chance.
So you can have more than one winner.
Yes, in fact, we're going to have, I believe, up to 30 restaurants will be chosen as winners, and 10 hair or nail salons.
Nice. Now, as far as mitigation strategies that restaurants implemented, are they still implementing those mitigation strategies, or
yes,
have
some
they
are. For example, I have not seen many restaurants that installed those plexiglass barriers between booths and things like at the bar. Most are still up. So I continue to see those. Every once in a while I'll go to a restaurant and all their staff are wearing masks still. Same with some salons. Most aren't asking patrons to wear masks, but frankly, when you get to a restaurant, the only time you're wearing a mask is when you're waiting to be seated.
Right.
Once you're seated and you're eating and drinking, you don't have to wear a mask, and that wouldn't work. So I do see some folks still with signs up. Many do not have those signs up anymore. So we're trying to encourage them to do some very simple things that don't necessarily have to be disruptive to their business.
Right.
We're not asking them to separate tables by 6 feet because that's a capacity issue, and I know these restaurants have been hurting, and to reduce capacity is not something that we're going to be asking them to do. If they want to do it, fine, but I wouldn't expect them to be doing that. But so things like signs, offering to host a vaccine clinic, putting up a poster that lets their patrons and staff know about the safety and efficacy of vaccines. If they want to offer their staff some time, even paid time, to go and get a vaccine, if there's a vaccine clinic running, nearby their establishment, we're running a vaccine clinic, let them run off for 30 minutes during paid hours.
Sure.
Go get a vaccine, come back to work.
Right.
That could be a policy that they could adopt if they want.
Right now, speaking of vaccine clinics, now what's the schedule for those? Now, are they now, obviously now we did a couple vaccine clinics from 4 to 11 for 4 to
Yeah, we did a 5 to 11-year-old clinic in
right.
Portland at the middle school, high school. We're going to be coming back, I think, this week actually to do second doses for anybody who showed up.
Okay.
I expect there'll probably be some other people who show up to get their first doses at that one. Hopefully it's not too crowded. It was pretty busy last time.
Yes.
So if you're thinking about coming to those clinics, I'd say come early and expect to wait a little bit.
Right.
So we're continuing to work with Griffin Health. We don't offer the Pfizer vaccine ourselves at Chatham Health District because of the handling requirements and the storage requirements. So we're partnering with Griffin Health to bring, mobile vaccine clinics out to the community for
Right.
people who want it, and we're going to continue to do that across, our towns, including in Portland. We are still offering booster shots, so if anybody's interested in getting a booster of Moderna or Johnson & Johnson, we carry both of those vaccines. They can feel free to give our office a call and talk to our nurse about getting a booster shot. But frankly, right now, there's no shortage of vaccine out there.
Right.
All the pharmacies are offering basically all 3 vaccines. And so it shouldn't be difficult if anybody wants a shot or a booster. If you're 18 and older and it's 2 months past your Johnson & Johnson shot or 6 months past your Pfizer or Moderna, you're eligible for a booster. So there's no shortage, but we like to make things convenient for folks. We did make a round to do booster shots for our older adults.
Mm-hmm.
Specifically, we work with our senior centers early on in February and March to offer vaccine clinics for our seniors because many of them really struggled with travel to distant parts of the state to get their vaccines, couldn't deal with the online registration system. So we already ran through and did some booster clinics for our older adults.
Mm-hmm.
And at this point, really, there's no shortage. Shouldn't be difficult for anybody to get a shot.
So basically, the booster shot, that's what, half the dose? Is that usually?
Yes, so for Pfizer and Moderna, it's half the dose. For Johnson & Johnson, it's a full dose. But for the Pfizer and Moderna, it's a half of what the dose you received during the first 2 shots was. So if you got 1 cc, you're getting a half a cc now.
Oh, okay. All right. Fantastic. All right. Well, it sounds like they've been keeping you off the streets.
Yeah, that's for sure. Definitely carving out time for myself now. I mean, it's important. Self-care they call it, Dave.
Yes.
I think everybody needs to set aside some time for themselves to decompress. And COVID-19, this emergency has really strained, public health and healthcare systems to the max at times.
Right.
So for anybody listening if you're in healthcare or education, frankly, teachers and administrators in our schools, really, our school nurses they've been real champions. Make sure you take some time for self-care. You deserve it. You need it because we're still in this for the long haul.
Absolutely. Now, as far as the education, do you think that education is working with the anti-vaxxers and so forth?
Well, I guess education continues to work. I mean, we're seeing more cases in our schools just because there's more cases in our communities. But schools continue to seem to be a pretty safe place, even when there's COVID-19 cases in the school.
Uh-huh.
We don't really see a lot of transmission. We haven't had a lot of pushback from true anti-vaxxers. I mean, it's a choice. You can get a vaccine, you don't get a vaccine. We haven't had many people pushing against our efforts to offer vaccines to people who want them.
Mm-hmm.
I know there is a contingent of folks who, feel like it's their duty for some reason to push against even us offering vaccines to people who want them. They feel like for whatever reason vaccines might be harmful, and they don't want their friends and neighbors to get it. So we really haven't run into much of that, thankfully. I'm aware that there is some of that around in
Sure.
both the state and the country, but we really haven't been impacted by that, so that's good.
No, that's a good thing. So, all right, Russ, I appreciate it. I think anything else you want to add before we wrap this up here?
Nope. Wear your mask in large groups, especially if you're with people you don't know or outside your household. It's crowded and it's indoors. Put your mask on, and otherwise, enjoy the holiday season.
Fantastic. I appreciate it, Russ. Thanks so much, and please have yourself a happy and safe holiday. And we'll keep you posted on the next podcast. Now that Ryan has got his feet wet here and getting his first podcast under his belt, we're going to be getting on a regular schedule here. So
great,
fantastic.
Awesome.
Well, Ryan, thank you so much for hosting our first podcast. Awesome.
Thank you for having me, Dave.
No worries. We're going to be doing more. And again, we'll have our special selectmen's meeting next Wednesday night as far as that goes. So on behalf of all of us here at the Town of Portland, I'm your host, Dave Kuzminski. We're live here in the Town Tech Educational Podcast Studio at Portland High School. And again, this was episode 44, and this was Ryan's maiden voyage. So we'll see you in a couple of weeks, and in the meantime, have yourself a safe and joyous holiday, and we'll catch you. Wear your mask, as Russ says. So thanks so much.
Thank you.
Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.